The patient is ready.
This may look like an ordinary day in the emergency room, but this procedure is anything but routine. This patient is about to receive the first human heart transplant.
Are you sure this is going to work, doctor?
Yes, I believe so. Definitely. Maybe.
But with all due respect, sir, it's never been done before.
I assure you the procedure will work. Ladies, today history will be made.
But what made this groundbreaking surgery possible? Let's go back to the foundation of surgery, understanding human anatomy. The year is now 1543 in Padua, Italy. We are witnessing an anatomy class taught by a man who revolutionized the field of anatomy, Andreas Vesalius. Before Vesalius, the study of anatomy was based on the teachings of Galen, a Greek physician whose teachings of anatomy had completely dominated for 1400 years. Vesalius was the first to publicly question Galen's teachings based on his own findings doing dissections of human cadavers. He proposed that Galen had used animals instead of humans in his research, which turned out to be true.
This is your superior vena cava, okay? Draining venous blood from your upper limbs, upper thorax, head and neck into the right atrium. Adjacent to that, to its left, is the ascending aorta.
He was passionately committed to unlocking the secrets of the human body, and in June of 1543, he published his book, De Humani Corporis Fabrica Libri Septem, a comprehensive anatomy atlas with detail and illustration that had never been seen before, covering bones, muscles, blood vessels, nerves, reproductive organs, and the brain. But what about cardiac tissue? What about epithelium? Sarcomeres? We had no idea these structures existed until a Dutch draper named Antony van Leeuwenhoek invented the microscope around 1674. In his spare time, Leeuwenhoek would create high-quality, single-lensed microscopes. The short focal length of his simple microscopes allowed him to see tiny organisms, which he named animalcules. He was, in fact, looking at bacteria and protozoa. He observed and described that these microorganisms could be found in water, conducted by air, and that most importantly, they were living organisms. Leeuwenhoek opened the door to the microscopic world. We could finally directly see the microorganisms we know today as bacteria, fungi, and viruses. But what was the function of these animalcules? Were they just passively coexisting, or did they have a more sinister role than was suspected? Agostino Bassi was an Italian entomologist who was one of the first to propose germ theory. He was studying the muscardine disease, a fatal disease that affected silkworms that was decimating silk farms in Italy and France. It took Bassi 25 years to find the cause for the disease, and in 1835 he published his findings in a paper called Del Mal del Segno Calcinaccio o Moscardino. He stated the disease was caused by a tiny living organism that was somehow contagious. He recommended the use of disinfectants, isolating and destroying infected caterpillars, and keeping farms clean. His recommendations saved the silk industry, and his findings were distributed throughout Europe. He went on to extend his theory that many diseases affecting plants, animals, and humans were caused by living organisms. Thus, he is credited for proposing an early version of the germ theory. While the germ theory had been introduced by Bassi, the world was not thoroughly convinced. Half the battle in science is being able to elegantly demonstrate your findings, and with inspiration from Bassi's work, Louis Pasteur was able to do so in 1878, thus bringing germ theory into the spotlight and enjoying widespread acceptance in the scientific community.
Bonjour mes amis. Today I've received a letter from Charles Buchanan from New York. Let me read it to you. Dear Monsieur Pasteur, I've always been a strong believer in the theory of spontaneous generation. How else can you explain maggot appearing out of nowhere when I leave raw steak out to rest by my window? However, I've heard rumors you do not believe in this theory. Please enlighten me. Sincerely, Dr. Charles Buchanan. Well, Dr. Buchanan, you might find this experiment very enlightening. I have two sets of flasks here, one with a straight neck and the other one with a S-shaped swan neck. Now watch carefully, I filled both with rich broth, and now I will boil them to kill all the bacteria already present. And when I seal them, we'll see what happened. Now, as you can see, both solutions are clear, showing that there is no bacterial growth in either flask. However, you could think that it is because I prevented oxygen from sustaining the spontaneous generation process. So let's open the flask and let's see what happened. Okay, now we see that the straight neck flask is cloudy with growth of bacteria, while the swan neck flask is clear as crystal. Parfait! En conclusion, que s'est-il passé? Well, living organisms in the air were able to form unobstructed in the straight neck flask, whereas they got trapped into the curved neck in the other type of flask. So as a result, they were unable to reach the broth. So, mes amis, if spontaneous generation existed, both flasks would have shown microbial growth, no matter what. However, in this experiment we show that the microorganism can only come from other microorganisms, which can travel in the air. Mesdames, Messieurs, c'est la théorie des germes, the germ theory.
While Pasteur had been able to demonstrate that microbes did not spontaneously generate, a German physician named Robert Koch was able to definitively identify, isolate, and culture microbes that cause disease. He is considered the founder of modern bacteriology. Koch was a country doctor and had access to many animals, some of which suffered from anthrax. He extracted the tissue of the anthrax-infected animals and was able to identify microbes using a microscope. Through methodological experimentation, he was able to isolate the microbe which caused anthrax. From this experiment, Koch developed 4 postulates, published in 1876. These postulates are the basis of identifying pathogenic microbes and finding the true cause of diseases. With this knowledge, we can develop treatments and prevent exposure to the microbe. One of the easiest ways to prevent exposure to pathogens in medical facilities was discovered before Koch developed his postulates. It was 1847, and a Hungarian doctor named Ignaz Semmelweis was working in the Vienna General Hospital. He was wrestling with a problem. In one of his obstetric clinics, there was an alarmingly high mortality rate of women dying from puerperal fever. Compared to the obstetric clinic staffed by midwives, the obstetric clinic staffed by medical students had a 10% mortality rate. Semmelweis had a revelation when his friend Jacob Kolechka cut his hand during an autopsy and subsequently died from infection. His symptoms before dying were very similar to the women dying of puerperal fever. Semmelweis made the connection and realized medical students were going straight from autopsies to delivering babies. They were spreading cadaverous particles to the mothers, which caused puerperal fever. He immediately instituted hand washing with chlorinated lime before students could deliver babies. The experiment was a success, with the mortality rate dropping by 90%. Unfortunately, Semmelweis's efforts were in vain, as the medical community scoffed at him, because at that point in time, germ theory had not been widely accepted. Semmelweis eventually went mad and was committed to a mental institution. Semmelweis's ideas were taken one step further by Joseph Lister, considered the father of antiseptics. Inspired by Pasteur's germ theory, Lister created carbolic acid as an antiseptic agent in 1867 that he used to wash his hands before performing surgery, applied to surgical wounds, and sterilized his instruments. To prevent open wounds from becoming infected during surgery, Lister proposed spraying the air with phenol to kill airborne microorganisms. These methods were considered bold and outrageous at the time. He also introduced carbolized catgut as an antiseptic suture, phenol surface disinfectants, and heat sterilization for surgical instruments by boiling. All of these methods greatly reduced post-operative mortality and paved the way for the surgical sterilization techniques we know today.
Tired of cleaning your instruments all day? Have you ever burned yourself boiling your forceps? Tired of no results? Try the new Chamberlain Autoclave. The new Chamberlain Autoclave. Sterilize your forceps, scissors, scalpels, retractors, glassware, make enchiladas. But wait, there's more. Order within the next 30 minutes and we'll send you not one, but two Chamberlain Autoclaves. Claves. It's a sterilization bonanza.
Well, that takes care of microorganisms on objects. But what about the microorganisms inside humans? The first antibiotic was discovered purely by accident by a Scottish researcher named Alexander Fleming. Alexander Fleming realized that the strange mold was releasing mold juice, which killed the surrounding bacteria. This marked the discovery of the world's first antibiotic, which Fleming named penicillin.
Hi, yeah, I'm calling about a strange mold growth I found on one of my petri dishes. Yeah, I actually left it out overnight. It seems as if the mold is having some sort of effect on the bacterial growth in the dish. Okay, thank you. Very interesting.
Next up is Alexis Carrel, a French surgeon whose interest in transplantation began in 1902 when he unsuccessfully transplanted a kidney from a dog's abdomen to its neck. Despite many more unsuccessful transplantations, Carrel eventually pioneered many techniques which are still relevant today, and made great strides towards achieving the first successful heart transplant. In 1912, he was awarded the Nobel Prize in Physiology and Medicine for vascular suturing techniques. In the mid-1930s, he invented the perfusion pump, which allowed living organs to exist outside the body. This paved the way for open heart surgery and heart transplants. The last remaining obstacle to successful heart transplantation was immunosuppression and the rejection of organs. Robert Schwartz and William Dameshek made the breakthrough discovery of the immunosuppressive properties of 6-mercaptopurine, which led to the creation of drug azathioprine. This drug greatly suppressed the formation of antibodies and allowed donor organs to be accepted by unrelated recipients. This final discovery propelled medicine into the modern era of organ transplantation.
Ladies and gentlemen, today we are carried aloft by the accumulation of our predecessors. Every failure, every loss, and every victory has paved the way to this moment. Truly, if we see further, it is by standing on the shoulders of giants.